Good day. This is the second part of the literature review and searching for literature. In part 2, we're going to focus on searching for literature. This is MQB7001 research method, part of the Master Public Health program from the University of Malaya. Hi, I'm Professor Dr. Victor Ho from the Department of Social and Palliative Medicine, Faculty of Medicine, University of Malaya. Searching for literature. What do you understand by the term searching for literature? What, from your understanding, how did we start? How did we search for literature? When I started off in my career as an academic, no, as a student, postgraduate student in University of Malaya, we used to, even as a student, a medical student back in those days, we need to go to the library to search for literature. And the first thing we need to do, we need to understand how to use the library method for searching for literature. Of course, those things are ancient, and currently you don't actually need to go to the library to search for literature, to learn how to write, to get literature that you want. Everything is available at the tip of your finger. So search engines have made our life so easy. And to understand, before we actually use the search engine, we must understand what is a search engine and how this has started. So search engines are programs designed to help us find information stored on the computer, such as the World Wide Web or even your personal computer. It allows one to ask the content meeting the specific criteria. Typically, those contain a given word or phrases and retrieve a list of references that match those criteria. Search engines are regularly updated and indexed to operate quickly and efficiently. Search engine usually refers to web search engine, enterprise search engine, or even personal search engine that search your own computer. Enterprise search engine are search engine that search the whole computer or server in the company. How does search engine work? Let's think about it. Some of you might have an idea of how it works. Of course, currently with the advent of AI or artificial intelligence, and then we have what we call Chat GPT, which is basically natural language processing kind of artificial intelligence, which is able to provide information to you and write what you need. But that is not what we are discussing today. Discussing today is about the web search engine. How does the engine works? How does it index your literature? How you retrieve your information? It is important for you to understand that different search engines index your literature differently. Then only you'll be able to understand the limitation of the tools that you're using. It is important to understand what information you get from your search. It depends on how you search it and how the information is retrieved. So search engine works by storing information about a large number of web pages which they retrieve from the World Wide Web. These pages are retrieved by web crawler or robots or spiders. And these are small programs that actually crawl the web to identify information and to store the information in the server of the search engine. Let's say Google or Microsoft, we use Bing. So all this information are stored in their server, and then when you query or ask a question in the search bar, you're actually asking the server, and the server will identify the information, and then it will link you to the original information. That's how search engine works. The contents of each page are then analyzed and determined it should be indexed. The way of indexing in the World Wide Web, Google search, and the way of indexing in search engine that we use for searching literature, uh, academic literature or peer-reviewed literature is a little bit different. But it is still what we call indexing. You got to index so that you can find the information in the uh, World Wide Web. These are some basic way of how the web actually works. Here are some of the old search engine or old web pages. Some of it you won't have any idea what they are because they have been there since the beginning. We have Google, of course. We have Yahoo. We have Lycos. We have MSN, which now have basically changed to Bing. So all those things are there, and of course Google dominates the search engine platform. And currently there are a disruption in this. Basically, we are talking about AI, artificial intelligence, natural language processing, but those things that we are not going to discuss in depth in this lecture today. So what are databases? So databases is where you store your data in a structured manner, and there where you can actually retrieve your data. But when we talk about databases in terms of search engine or search that you can do for your literature review, these are where they store the data of the paper, of the information of the paper. So the storage of the data in a medical database and in a Google search engine database is different. So here are some of the medical database that's available: Medline or PubMed, Embase, ScienceDirect, Scopus. There are many other medical databases are there, which actually index the paper. Google Scholar is another scholarly database that actually index the paper. So they actually index the paper, but the indexing part is different. PubMed, Medline, Scopus, ScienceDirect, and all these medical database or scholarly database, excluding Google, are indexed based on the information provided by the publisher. Let's say Elsevier or BMJ or even MGM. They provide the information to Scopus, to ScienceDirect, to all these databases, so that the information of their journal can be indexed and it goes into the index. And this information are presented in a structural manner, which we're going to go into it later today. So this is important for us to understand that medical databases are indexed differently, are stored differently, or scholarly databases are stored differently. For Google Scholar, it's different. Google Scholar, you don't need to send information to Google for your journal or paper to be indexed. They use crawler to crawl and index those papers. So there's a different technology involved. There's a different way of doing it. Which is better? The one that is the scholarly database, excluding Google Scholar, like medical databases, are better because the information that you get is more structured. That means that you would be able to get the correct information that you want based on the different categories of information that you want to retrieve. It means every time if you ask the same question for those databases, you get back the same answer, which is different from Google Scholar. Google Scholar, even you ask the same question, you get different answer because there are different way of indexing and the information is not 100% complete. They index from using the keyword index only without indexing using other method. I've explained to you already what's the difference between a search in the web and medical databases. It's the way they index the paper, index the information that makes the searching in the web and medical databases or scholarly databases different. So you need to plan your search. You need to plan before you actually search. Firstly, you need to develop your research question. What is a research question? What is a good research question? That's very important. Then you develop your search strategy, break your search strategy in, break your question into concept and pass, link the concept into a search strategy, and select the databases or search engines that you want to use. That you have to decide earlier. Usually we suggest or we recommend that you use at least 2 different search engines for you to be able to cover most of the literature available. We know that certain search engines are Western focused, certain search engines are more global focused. Like your Medline or PubMed focus are in the US, but and your Scopus, the focus are more general, more what we call local or Asian. That's why you want to look for studies that is related to Malaysia, Indonesia, or regional. You would search Scopus database, not just PubMed, Medline, or Science Direct, because Scopus database would provide you more papers that is coming from this region. Then you need to review your search, review the number of titles, review whether you focus or explode the search. Explode means you search for everything that is related to the same topic that you're talking about. Title, abstract, full text. You get the title, you review the title, whether the title is related to your study. Then you read the abstract. From the abstract, you'll be able to identify whether it's related. Then you go into the full text articles. What makes a good search question? Think about it. What makes a good search question? The question should be relevant to the problem, of course. It should be theoretically sound. That means it should be clear that there is a theory behind it. You need to be properly phrased because you want to know what is the subject, what is the object, or what is the independent variable, what is the dependent variable. All right, then produce relevant and precise answer. That's what a good question is about. So first, we must develop a good research question. Let us think of how to develop a good research question. Tell me, what is your research question? We are going to discuss this later. You can use different method of doing it, and it all depends on the type of study that you want to do. If you want to do an interventional study, you use the method called with the abbreviation of PICO, P-I-C-O, which basically looking at it from a patient or population. So it's important to say patient, population, or problem. Then I is an intervention, identify intervention. C is control or comparison, and O is outcome of the result. So you look at population. Who is the population that I'm going to study? Intervention. What are the intervention that I'm going to assess? What are the comparison or the comparison group or comparison intervention that I'm going to look for? What outcome am I interested in? Of course, in epidemiological research, usually we don't look at intervention or control. We look at more of exposure. If you're exposed to something, what are the outcomes? The exposure can be, let's say, we discussed earlier, occupational hazard in the workplace, correct? Or chemical hazard in the workplace, or psychological hazard in the workplace. It's an exposure. Exposure can also be genetic exposure, sexually transmitted disease, infectious disease. Exposure can also be type of food you take, type of things type of what we call diet that you consume. So that's called exposure. And the outcome will be, do you develop the disease or not? Do you develop a symptom, like I say musculoskeletal disorder, or are you going to have diabetes, hypertension, and then obesity? Obesity can be exposure and also can be outcome. So it depends on how you do. Obesity can be exposure for hypertension or exposure for cardiovascular disease, but it can be outcome when you talk about diet. So the things you need to be clear when you talk about exposure, outcome, and problem population. Develop your search strategy. It's important to develop, write it down, either use the PICO or use PEO. PICO is patient, population, intervention, control or comparison, and outcome. PEO is population, then exposure, then outcome. Your search can be narrow, which is basically you just use a lot of N to come out with just what you want. A narrow search is of limited value unless you want to do it dirty and fast for you to come out with a focus of your mind. Usually a narrow search means that I really have an idea. I know what I want to say. I know what I want to tell. I'm just going to find those information to support my idea. So that's what we call a narrative kind of review, where, and usually it's more biased because you know the idea already. I know that I want to find out whether vaccine is effective or not. I will look for paper that is look at effectiveness of vaccine, and I would not include papers that don't look at don't write vaccine effective. Same thing for a lot of things, a lot of research that we can do. That's why sometimes when we say that your literature review, is it extensive enough or not? Does it cover all topic? Does it look at all issues? It's important for you to understand why you do a systematic research and what is a systematic research. Systematic research is something that you ensure that you have a broad or wide search so that you cover all the different areas or topics within the search area. So you have wider search, you cover everything, and then you sift through all the information, and then those information that you don't want, you throw away. You only keep the information that you want, but at least you know what kind of negative and positive information that you can find. So once you have a research question, you need to break the research question into parts or component that fits into your PICO, patient, intervention, comparison, and outcome, or PEO, patient, population, exposure, and outcome. P, children with fever. I, paracetamol. C, ibuprofen. O, reduction of fever. This is a very, very common example that a lot of people use. And for systematic review or for searching for literature, it is used now because it's easy to understand, because it's easy for you to know that, because it's much more personal and it's important easier. But once you look at patient, children, is there another term that we can use for children? Maybe toddler, or maybe whatever word you can think about. Then fever. How can we again focus on fever? Can be febrile, can be high temperature. Intervention. You look at paracetamol. What are the terms that people use for paracetamol? What are the generic name for paracetamol? Or what are the registered name for paracetamol? All right. Comparison, the same thing. What are other names for ibuprofen? And outcome is reduction of fever. Usually when you search, you can search patient, intervention, and outcome without comparison. So, Depends on whether you are linking it to compressor or not. So you get all this, you get the P, you get the I, you get the C, you get the O. You need to link them together. Linking is when you connect all the keywords and data research for you to be able to get a more cohesive or complete search. So Boolean is used in all databases. The major Boolean is and, or, and not. So what is Boolean? Boolean is the same thing. Remember, we done do it in modern maths when we talk about Boolean, and we look at the Venn diagram, and then you basically understand when you use and, when you use or, when you use not. You have some databases, most databases also use truncated word. Truncation is important for you to be able to cater for the different spelling of the same word. Alright. Like practice and practice. One is spelled with a C, one is spelled with a S. All right. So all these things are because of the different languages that we use. So Boolean and is used to indicate that both terms must be present and specific in nature. Then with the Boolean or is used to indicate that any of the term may be present, inclusive in nature. And we have the Boolean not. It is to eliminate an unwanted concept or words in your search statement. So this is how the Venn diagram look like based on your Boolean. Search strategy use bracket to nice a synonym equivalent concept together. All right, and usually used with an or. Useful for free text search. Example, fever or febrile. That means you use either fever or febrile present, you'll be included in your search term. Quotation mark. So what does quotation mark actually do in search? If you put high temperature, your search, even Google will search high and temperature. There are some, currently I think they are much more smarter, they can search a complex word. But to ensure that they search the word as a complex word or term, you use the quotation mark to group them together that this is a complex word that you must use, that two of the word must be used together. All right, so this is what I was alluding to just now. The other way is doing truncation or wildcard. All right, so truncation is where you know that words like child, children, and childhood also can be considered as child. So you just use child and use the asterisk to truncate the word. Truncation is different for different databases. You need to go to the databases to learn what kind of truncation they use. PubMed uses an asterisk. Orbit uses a $sign for truncation. Caveat is basically it depends on the database, so you must make sure that you do the right thing for the right database. Some database allow truncation to cope with variation in spelling, like behavior and behavior. Why does we put the $sign there? Because behavior spelled in English is different from behavior spelled in British language and the American English. So it's BEHIVOUR in British and BEHAVIOR in America. So British, they use the word you. Consult help screen to find appropriate symbols. Not all words are suitable for truncation. Example, plan and care. If you don't know, if you need help, you must know that you have access to our librarian, and our librarian is actually there to help you to develop the search strategy. It is their role, is their duty, is what you're part of your learning that they can actually help you. So go to the library, talk to the librarian. So let's put it together. Child and fever, febrile, high temperature, or ibuprofen or Advil and paracetamol. So the idea is that if you look at PICO, within the P you use or. If it is you want to join between the P and the I, you use N. So you use N for P and I, C and O when you want to join all four of them together. Putting it all together, string search, number search set for each combination, useful when having multiple concept and multiple variant, useful for long string which do not fit into search box. So it's always better for you to just search and then combine it together. So it's easier. You can use any of these searches in databases. Depends on your research, depends on your research question, depends on your study area. It is important to know that each of these databases are designed for certain group of study areas, so they are focused on the paper for those research area. But as I say, if you want to do a literature review, you need to use at least two databases, and we recommend Medline and Scopus. There's the two databases minimum that you have to use. Medline is American focus or Western world focus, less information from the Eastern Bloc or from the non-English speaking area or from Asia, South Asia area. So a lot of our papers from Indonesia or from around this region are published in Scopus Index Journal. So even PubMed, they don't have information. So it's important for you to understand where to search, how to search. Medline is one of the comprehensive medical database. So you must understand, Medline is a medical database. You are searching Medline to look for that research or papers related to medical issues. So you want to search for other things that is not related medical, like psychological, psychosocial, all those things, you need to search other databases. So it covers the medicine, nursing, dentistry, veterinary medicine, and healthcare system. So that's why you need to understand, when you use a database, you need to understand what is the focus of the database. You cannot just search the database without understanding the focus. It's actually from the NCBI, National Center for Biotechnology Information. It's a US National Library Medicine initiative. It's freely available. Use PubMed. You can use PubMed to search. If you don't use Medline, if you don't want to use PubMed or Medline, you can use other search engines like Ovid to actually search Medline or PubMed. So this is Ovid Medline. So Ovid Medline is basically, you can search multiple databases using Ovid. This is a program that actually can search multiple databases. So this also can be used if you want to. But it needs a subscription. So usually we recommend PubMed, which don't need a subscription. So we look at the three databases: PubMed, Cochrane Library, and Google Search. We just discussed the three databases, then after that we'll go into it later for the demonstration. PubMed, very similar to Ovid Medline. Free access includes some links to free full text journals or articles. Specialized features include subject heading and clinical queries filters. That's basically focused on medical issue, like depends on your clinical focus, like cardiology or things like that. So you can automatically merge search term or mesh and combine with keyword search. Cochrane Library, includes 7 databases, including the Quotation database of systematic review. So Quotation library actually focuses on intervention study. It looks at what are the best intervention for certain condition. All right. Summarize systematic review and clinical trials. Google Search Scholar, as I mentioned earlier, Google Scholar is different from the normal medical databases. Google Scholar actually focused on using robot or spiders to actually crawl. All right, so unclear of the content included, which journal are covered, and the search method also is very different. So we discuss on MeSH. What is MeSH? MeSH is basically medical subject heading. It is developed by the National Library and controlled vocabulary used for indexing articles in PubMed, but it's used in other databases also. So elements of answerable question. This time we say PICO, but also we can look at it from the PEO, which most of us will be doing. Population of problem, exposure of interest, and relevant outcome. Let's just skip this. Let us move back to questions that maybe you all can answer. How many databases do I need? Is Google Web Search adequate? Google Web Search, I'm talking about Google, not Google Scholar. So what is the difference between Google Web Search and Google Scholar? What's the problem of using Google Scholar? And how do I summarize or present my search result? We'll discuss this in our class, in our discussion later. So hopefully you can go through these slides before our class start. Okay, thank you very much. Have a nice day.